Good afternoon, everybody. How are you guys? Welcome to our LHC Reach Out webinar. My name is Josie Gaitan. I work for Reach Out, a nonprofit organization in the Inland Empire. And today we are going to have a very exciting webinar. Dr. Shapiro is coming back. We have Ashley from Reach Out. And we would like to ask you if you guys can note this number. Jesus is going to put it in the screen. If you guys need translation, and I'm going to say it in Spanish. Si necesitan traducción, por favor, marquen el número que va a poner en la pantalla Jesús. Bienvenidos a todos. Tendremos al doctor Shapiro hoy acompañándonos. Él va a llegar a la 1 de la tarde porque tuvo poquitos problemas en el hospital, pero nos va a acompañar a la 1. So, trajimos a Ashley. Ella viene de Reach Out y nos va a dar unas pocas explicaciones de unos programas que tenemos en Reach Out, por mientras que llega el doctor Shapiro. Le queremos dar las gracias a Ashley y al doctor Shapiro. We want to say thank you to Ashley and Dr. Shapiro. Ashley is from Reach Out, and she's going to be talking about our Youth Grant Makers. It's a new program that's we're reopening in Reach Out. And Dr. Shapiro is going to be here at 1, so take a little longer. I was explaining, if you guys please get the number and note it down. I don't know if he's going to make his presentation in English or Spanish or both, but just in case you would like to get translation in English or Spanish, you can call that number and we would translate for you guys. We are going to be talking about all the COVID, the vaccine, and I did say it right, and giving you information, updates of what's happening, what's going on, why, what are the difference on the 3 different vaccines. So it's going to be a really good information. So now with you, I will let you know, we will have questions and answers, AQ, and at the end of both speakers, after each speaker, we would like to just, if you guys have any questions, just put it in the chat. And then we'll either way, hopefully Dr. Shapiro won't be a little late. So we want to welcome our speaker, our new guest today, Ashley, an outreach specialist, policy specialist from Reach Out. Ashley, we give you the floor.
Hi, thank you so much for having me here today. I actually did a presentation for LHC a few months ago, so I'm happy to be back and talking about our Youth Grantmakers program, and I'll be touching a little bit on some of our coalitions as well. So as Josie mentioned, I'm an outreach and policy specialist, and I work in Reach Out's Community Health and Policy Department. In that department, we have different programs, and the ones that I specifically work under are the environmental prevention, or what's also known as the policy and prevention program. And so what we do in there is we work to reduce substance use in the Inland Empire among youth and young adults. And we do that through a variety of different means, such as media advocacy, enforcement, policy making, and we just utilize different strategies to make sure we are decreasing substance use in the area. In order to do that, we also have created some youth programs. One program that we actually have already started and we are currently in the midst of training our youth is a youth court. So we're really excited about that. We have a great batch of kids, and we're also working alongside Reach Out's policy consultant, Fred Alvarez. I'm not sure if any of you are familiar with him, but he's actually a retired detective from Ontario PD, and he's been really resourceful for us in creating our lesson plans for the youth and basically just getting up that youth court up and running so that we can really disrupt that school to prison pipeline. But in addition to youth court, we are currently recruiting for youth grant makers, which is what I really want to get into today. So youth grant makers is actually a program that Reach Out has facilitated in the past and has had a really successful time in doing so. But unfortunately, we were not able to keep it going until now. So now we have a whole new team, including myself. I was not here previously when this program was being ran, but I'm really excited to be a part of it now. And it's going to be going through a little bit of some changes as well. We're going to be taking a new direction, trying new things, especially in, this new virtual world. Obviously, the types of things we've done before have had to be accommodated and altered, as many of you may understand. I mean, we're here today in this virtual webinar, so I think that just goes without saying that we are able to accommodate under huge circumstances of stress. And we're also just utilizing this opportunity to expand our reach, especially with youth grant makers. We've been able to open it up to youth all over the Inland Empire. So a little bit about this program is basically what it says. We are going to be creating little mini philanthropists out of these youth who decide to join, and we'll be giving them the skill set and really the understanding of what it means to work in the nonprofit world, all of the work that goes into applying for grants, into reviewing grants, and it'll be up to them to actually fundraise in order to give out their own little mini grants. And in order to do that, they will be utilizing a platform called Giving Circle, which is a lot like GoFundMe in the sense that it's a online website where you can basically, give money to join this little circle, so to speak, and it if you are in line with the values of the youth, which will be things like mental health, substance use prevention. So once they are able to crowdsource a certain amount of funds, they will actually be reviewing a certain amount of nonprofit organizations in the area that they feel are in line with what is most important to the youth of Inland Empire. So if it's something along the lines of youth mental health, then an organization that is planning to address the needs of, youth mental health, then the youth will be able to decide if the funds should go to that organization versus another organization. It just depends on what the youth feel is most important at this given point in time. So that is what we're currently planning for our Youth Grant Makers program. And as I mentioned, we are currently recruiting. So that is one of the main reasons I really wanted to come on here today to inform all of you on this call about this program. So if you know of any youth who would be interested in this, please reach out to me. My email is ashley@we-reachout.org. And if you are unable to catch that, you can also reach out to Josie and she can forward you my information. The deadline to apply is on the 8th. I know it's coming up quick. We have extended the deadline previously, but if you know of anyone, please give them this information, or you could just give them my information and reach out to me if they have any questions. So that is my little spiel on Youth Grant Makers. I did also want to talk a little bit about some of the coalitions under our program as well. One of them is the Fontana Community Coalition, which operates within Fontana. And again, some of the values have to do with reducing substance use within Fontana, especially amongst youth, and preventing those things from even starting. And the FCC, Fontana Community Coalition, has actually just been granted the Drug-Free Communities Grant. So now we have new work plans. We have, more resources to do the work that we really want to do within Fontana. And if that's something that you're interested in joining, if you're interested in being a part of, again, you could either email me, or the coordinator for that coalition is actually Michelle Holguin, who couldn't be here today, but her email is michelle@we-reachout.org. And then lastly, another coalition that we facilitate within the Inland Empire is Partners for Innovative Communities. And if you're unfamiliar with that, it spans all of the Inland Empire, so it's not just exclusive to one city. And we have 3 work groups within that coalition. So you have a more focused work for that specific group. And there is the Substance Use Prevention Work Group, and we're currently working on starting up an advocacy program where we train adults and parents on how to talk to their youth about substance use prevention, how to destigmatize substance use, and how to just advocate for the health and well-being of our communities. Another program or another work group within PIC is School Climate, and that one aims to address the mental health of youth and overall the environment of schools. And actually underneath that work group is where you find the Youth Grant Makers program, since Youth Grant Makers, one of the biggest tenets of that is prioritizing mental health of youth. So that work group works to support that program, if that makes sense. And then lastly, the work group that we're also, facilitating is the restorative justice work group. And under that work group is the youth court. So as you can see, each work group functions and works alongside the programs that we have underneath that. So again, if those sound like of any interest to you, and if that's something that you would like to get involved in, please feel free to reach out to me and email me. I could give you more information. Those meetings or those coalitions both meet bi-monthly. So we just had the meeting for PIC in the end of February, and we'll be meeting for FCC in March. We will also be having the work group meetings for PIC in March as well. Are there any questions?
Ashley, I have a question. Can you give us a number where they can call to get more information for the youth makers? And is that only in one county? I didn't hear you. I'm sorry.
No, that's okay. So for youth grant makers, it's actually the entire Inland Empire. So either Riverside or San Bernardino County youth can apply. We don't really have any limits on, the certain city or certain county. And then for the age limit, we are seeking sophomores to seniors in high school. So for the age range, we're looking at about 15 to 18. But again, if someone is interested and maybe falls outside of that, they can contact us and we can see what we can do about that. And then as far as a number goes, if they would like more information, they can just call the reach out number, and then that will just be forwarded to either myself or Michelle if they would like more information.
Oh, thank you very much. Okay, I haven't heard from Dr. Shapiro. Thank you, Ashley. Is there any questions in the, sorry, is there any questions in the chat, Jesus?
Let me double check.
Ashley, don't leave us because we have questions for you.
I'm here, don't worry.
Okay.
Okay, there's one question. It says, do I have to be a part of the city in order to join the coalition of that city?
No, you don't. It's definitely welcome to all, but for the FCC Fontana, it mostly operates within like influencing policies of Fontana, but you don't have to be an actual resident of that city.
And we have another coalition. Did you talk about PIC?
Yes, I did.
So anybody can join any of the coalitions, correct?
Yeah, you can join, even if you didn't even really live in San Bernardino or Riverside County, you could still join. Obviously, if you are, a certain stakeholder, if you work in one of the cities, you could also join that way. But we don't really have any restrictions as to who can join depending on where they live.
Okay.
As long as you are passionate about helping these communities, that's all we really want.
Let me see. Something just came in. It says, so it says, can you explain about youth court? When is it open again for the youth? Is it virtual?
Yes, so I should have mentioned both of the Youth Grant Makers and Youth Court programs currently are happening virtually. So the training process for Youth Court, which is where we're at right now, is occurring virtually. And so when I say the training process, I'm talking about our youth volunteers. So if you're unfamiliar with Youth Court, essentially it's stimulating a regular, juvenile court case type of situation, except obviously they're not going through the actual juvenile justice system. Instead, they are actually going to be judged by a jury of their peers, so by other youth. And in this process, the youth jury, which will be asking the defendant questions, trying to figure out getting to the root cause of the juvenile crime. And the different types of juvenile crime are going to be petty things. So things like petty theft, constant truancies, things like that. We won't be taking any type of felonies or violent crimes. So the youth jury members will be asking the defendant questions. Basically, like I said, just getting to the root cause. Maybe there's problems at home, just kind of really trying to understand how we can ensure that something like this won't happen again. Our main goal is to really reduce recidivism when the respondent goes through youth court. And then so we're currently, again, like I said, we are training those youth volunteers. So the youth who are going to serve as the jury members, we're making sure that we train them on, the juvenile justice system, what it means to be a jury member. We're training them on advocacy and restorative justice processes. We will start taking cases in later this month or early April, and we get our cases through the San Bernardino County Probation Office for juvenile offenses. So I hope that answered your question. We may also be taking school referrals, but that's just something that hasn't really been decided yet. So if a school wants to refer a youth to the youth court for something like truancy, they are more than welcome to contact us, and that's something that we can decide in the future. This program will be ending though towards the end of June, but we do plan on keeping that rolling and just kind of having it be like a seasonal thing. We would probably start taking applications for the youth volunteers once this session is passed in the fall of this year.
And then another question asks what the time commitment is for the youth who want to volunteer for youth court.
So for youth court, like I mentioned, we have already started that program. So if they wanted to join later on this year, currently the time commitment is about 3 hours a week. We meet once a week and for 3 hours. For youth grant makers, however, the time commitment is a lot less than that. We meet about once a month for 3 hours. There will be about 2 months where we are doubling up. So it'll be every other week they'll be meeting as opposed to once a month. And again, those meetings will be 3 hours.
Ashley, are those meetings open to the public so they can go in and see, or are they closed session?
For youth court or for youth grant makers?
For youth court.
Youth court, the trainings, I think we would probably be open to having, observers. I'm not sure yet. I'd have to confer with the rest of my team. As far as the actual, once youth court starts and we have defendants, that will not be open to the public though, just to ensure confidentiality of the respondents.
So it's a peer-to-peer program. Everybody there's peer.
Yeah, it'll be mostly peers. The only adults we'll have an adult judge who just oversees it and just make sure that they stay on track. And that'll be a volunteer judge or a volunteer attorney, or even Fred Alvarez, who again is our policy consultant. He may also function as the volunteer judge. That's something we haven't decided yet.
So can any youth from outside, from other schools, can come and join those meetings to become
if they want to, if they're interested in youth court and they kind of want to know what the training processes look like, I'm sure we would be open to having observers come and see, what it's like. So that way during the next session that they can, know what they're getting into essentially before applying.
Okay.
Another question that came in what are the benefits for the youth? Like, is there like school credit or like letters of rec?
For both programs, we are offering a letter of recommendation from our CEO, Diana Fox. They can also get volunteer hours if they have some type of, civic project that they're working towards. We're more than welcome. We're more than happy to sign off on those hours for them. They can also put it on their college applications as well as their resumes.
Do you have any more questions in the chat?
Not yet.
So where, can you repeat and tell me where these classes are going to be?
Yeah, so they're happening virtually right now due to COVID-19. And as far as the rest of youth court, sorry, I have the hiccups. That will be happening virtually pretty much until the end of the season. So both programs currently are happening virtually until further notice. If we were to, potentially magically be out of this pandemic by the end of the year, once we've started up the, other sessions and started, re-recruiting for a new kind of session, then we would have to reconsider. We would probably be meeting at the Upland office. But for the time being, and for future reference, they are happening virtually just for the safety of ourselves and the safety of the youth.
Okay, thank you, Ashley.
Another question just came in. So if if it were to go back to in person, would there be a chance of still having a virtual component to it?
Actually, yeah, I think that's something we would definitely be open to, just so that we don't, close it off to other youth in the area who can't make it to driving to the Upland office. I'm sure we would find a way to still incorporate them with this, new virtual possibility that I think we've all been able to open our eyes to.
Thank you. No more questions?
Let me scroll a little. Okay, this one asks, are there recordings right now that my kid can view?
There are recordings. I'm not sure if we've decided if we would be willing to send those out. However, you can contact me again and I can confer with the rest of my team to see if that's a possibility for interested youth. Because we do have recordings. Right now they're just being used for youth who miss sessions so they can make up that time. But I think that's definitely something we would be open to if they have interested youth who would like to be a part of youth court during the next session.
Okay, and then there's another question asking to restate the ages that you're looking for.
For youth grant makers, the age range is about 15 to 18.
And for youth court?
For youth court, it's around the same age, but I believe we actually opened it up to younger college students as well. So that one, I believe we currently don't have any college students, but we did open it up to people around the ages of 15 to probably, I think, like 20, 21.
Thank you, Ashley. I just have a comment. I know we had youth courts in several of the schools that we worked with a couple of years ago. And one was in Jurupa Valley, which I was very impressed. One of the students that started youth court in 7th grade, by the time she got to 12th grade and she graduated the year before, she was like running the whole program. She was telling the new students what to do and what to say. So she was all into it. And I think she was starting to go to become a lawyer. So it was very interesting. Yeah. How they change in their attitudes, and it helps both the ones that are in trouble and the ones that are learning. So it helps them both. So I've seen it, and it's a very good program. I just got a message from Dr. Shapiro's receptionist, or I guess assistant, and he had an emergency, but they're trying to see if they can figure something out. They have he usually comes in lunchtime, so that's why it's very hard for him to sometimes misses things, but they're trying their hardest. But we're gonna wanted to say thank you, Ashley, for bringing us all this information. If there's any other questions, Jesus, we'll just continue with I'm gonna bring in Myra so she could talk to us a little bit while see if Dr. Shapiro is able to get back to us. Is there any other no more answers, questions for Ashley? Thank you, Ashley, for coming and giving us all this information. And we can stay with us. If they have any more questions, they can put it in the chat after the next speaker. So I just want to introduce to you, and I want to apologize. Dr. Shapiro apologizes. He's trying his best to get out of somebody to replace him and to come to the webinar. But Myra, do you want to come in and talk to us a little bit about the information that we have about the shots and COVID? I know we started to work here in Reach Out, so we have information where you guys can call, numbers where you guys can call and get appointments. But Myra, welcome. I'm sorry to put you on the spot, but I think you have more information. So if you can bring us a little bit of information about the shot, we would welcoming you.
Thank you, Josie, and no problem at all. Yes, you know that right now the vaccination has been open even for people that is currently working in food and also in the field. So we now are able to vaccinate people from 55 and older that are working in food and agriculture. Also, the people that was already open, that was for 65 and older. My bad. So we do have a lot of resources in the Riverside County. There also have specific clinics in which you can go. You can even ask to your own doctor if you can get your vaccine. The reason why you need to ask first, and this is not for everyone, but when you have a certain condition, let's say that you had an anaphylactic reaction or an allergic reaction to a previous vaccine, not specifically COVID, if would be your first time getting it, you need to ask to your doctor if it would be good for you to get the vaccine. Another thing that you need to make a note, like a mental note about, is that if you got the vaccine for the first time and you got a allergic reaction, it would be better for you to not to take the second dose. Why? Because what your body does is actually recognize that antigen. When it recognizes it, it triggers a response. That response that was exaggerated the first time, it could be worse the second time, and that could be dangerous for you. So right now, you don't need to have a medical insurance to get the vaccine. You just need to go to, if you can go to My Turn California. You can even go and dial 211 for get more information. They can share with you the numbers where you can call. And if you go to the website, it would ask for you if you want the information in any language that you need it. In this case, if you're Latino, you can request it in Spanish. And you can access to the website, choose a date, and that will give you a site according to your zip code that is close to your home so you can get vaccinated. Another way that you can do it, if you are not computer savvy, you can actually call to a number that appears in the My Turn California webpage, and they would help you to schedule that appointment. As I said, it depends on pretty much every county, how they are doing it. In Riverside County, even your doctor's clinic can let you know where you can get it. In some other places, that California County, there are even some CVS pharmacies that are already have vaccines available for their patients. So if you want to go and read a little bit more about the vaccines, it would be good if you can go to the website. Let me try to pull the website for you so you can see it, how to navigate it.
So while Myra's looking, did you find it?
Huh?
So we are
Hello?
gonna. Sorry, I have noise outside, so I don't know if you guys can hear me or not. So while Myra is looking for the website, I just wanted to let you guys know, Reach Out is going to be participating in helping people that are need help to get their appointments. And I'm going to give you our phone number, and you guys can start calling us. We'll have more information next Thursday. Sorry. And I am going to give you a number that you can call Riverside County, where you can just call and they make you your appointment there and then. And they need your information. They'll need your birthday, your home address, the same one that has the same. It has to be the same one you have in your ID, your California ID. And then they make your appointment right there and then. But we are going to be helping you guys directly to do your appointments, to tell you what you guys need, anything you guys need to know about the shots, the sites where they're at, where they're taking them, where they're giving the shots. So whatever you guys need, we'll have more information for you guys next Thursday, and we will put our phone number. And if you have any questions, just give us a call. You can always call me or call the office number. We pick up the office number.
I saw a question in the chat that it says, if you had COVID, do you need to get vaccinated? Having the disease, it does give you a certain type of protection, but it would be practically on your doctor's best knowledge if he let you know you go and get the vaccination. The vaccine actually helps for you to get prevented to get hospitalized. So what they are trying is not for you to not to get the disease, it's just for you to not to get the worst cases scenario, which it could be in the ICU or eventually to die. So that is what the vaccine is preventing. So if you had COVID-19, it would be still great to get the vaccination, but your doctor needs to tell you in which time period after your recovery you can get it. Can you see my screen?
Yes.
So here's my turn, California. I don't know if you guys can see it completely. And it's for the COVID-19 vaccination. So what you do, you basically choose your language. Let me try it in Spanish so you guys can see it. And you would choose if you are eligible or not. So here you have to certify that you are 18 years and or older, and that you consent your provider to administer the vaccine, and that you have read everything that I already mentioned. So you practically check every box, and then you have to choose your age. So I'm going to use the one that I already mentioned, that is 15 and older, for food and agriculture. I would choose my county, and let's use Riverside County. This is optional. You don't have to add any zip code. Can you give me 1 second? Sorry, I opened something. So, Josie, do you have a zip code that I can type from Riverside?
92509.
92509. So this would be the closer area where you can get the vaccination for that area code. You go to the provider website. Let me try it one more time. Let me refresh. Okay, so right now it's not working. And that is another thing that we have encountered. Why? Because there is a lot of people that right now is trying to get the vaccine. Can I stop sharing, Jesus? So even though you don't get your appointment for the first time, please continue to do it. The suggestion is to try it really early in the morning, to be precise at 1 a.m. if you can. Between 1 and 4 are the hours that you would not find a lot of people in the website, so it would be easier for you to actually get an appointment. The phone number that is open to get the vaccines, it is open from 8 a.m. to 8 p.m. Monday to Friday. And Saturday and Sunday, they're open from 8 to 5 p.m. So if you can call, you can do that as well, and they can assist you if you are unable to get your appointment. As Josie mentioned, Reach Out is also trying to bring this type of help to the community. So we are trying to get those appointments, or help to get those appointments, for all local community in Riverside and San Bernardino. If you have further questions, you can also contact us. And I see someone, will the vaccine have to be taken every year like the flu vaccine, or will it be possibly of having it taken every 6 months? That is such a great question, Teresa. And let me tell you, COVID has come and it's not planning to leave. So probably we will have this vaccine in the same way that we have the influenza. How often we need it, that would depend in the flares, that the season in which COVID would be higher. In the same way with the influenza, there are some specific seasons in which we have that vaccine, available, just because we know that we had a lot of cases of influenza in those seasons. So it would be probably in the same way. what we are trying is just to decreasing the numbers, not only the numbers of people that gets the infection, but also the numbers of people that gets into the hospital, and mainly the number of people that die. So we don't want to lose anybody else due to this infection, and that's why, along with the measures that we already taken, wearing masks, washing your hands, wearing gloves if you need to, stay 6 feet away, and on top of that, the vaccine, what we are trying to do, and we have seen it so far, is the numbers going down.
So thank you, Maya. So we are working here in Reach Out. We are working on how to process the information to all of our communities. We're going to be working with Riverside and San Bernardino County. And we are going to be one of the persons that are going to be giving all the information where they're giving the vaccines, how you can go get tested, and a lot more information, educating everybody on all the new things that are coming up. We'll be practically ready by next week. I will put my number down, Reach Out's office number, and I will also give you a number where you can call if you're 65 and over, and somebody will actually pick up the phone and give you the appointment right there and then. You do need your ID with your address. If you're under 65, you need a letter from your employee why you're able to get it. It depends on your job. And they'll ask you for your birthday. And I think those are the only 3 things. But we'll get more information, but we will be doing this starting next week, and we'll have more information and all the numbers. We will have people that can do translation. We are going to have people that are going to be making the phone calls or putting it into the computer to get your appointments for you. So we are going to be working on that. I just wanted to let you know. We are getting everything prepared and ready for you guys. So if you guys have any questions regarding, I haven't been able to get through because I've noticed it's been really hard to get through either through the computer or through the phone to get an appointment. So that's why we're working and putting something together for you guys so we can help you do it for you. You can call us and then we'll just get you your appointment through our computers. And we're going to have people working doing that, especially just specifically on that topic. So I just wanted to thank you. I apologize again. Dr. Shapiro is not coming in. He does it through his lunch, and he wasn't able to get even a lunch because he was they've been very, very busy, and they had an emergency in the clinic. And I apologize. But we do want to invite you for next week. We are having a panel here at our webinar with a teacher from El Paso, Texas, a teacher from Chino, a teacher from Phoenix, Arizona, one from Colorado, a city of Riverside, a teacher from Jurupa Valley. And we're having like a panel to ask them questions. How are they dealing with everything that's going on? What do they feel? What are they issues that they're having teaching in the computer? Some of the states, Texas and Colorado, are teaching half of the class inside the classroom and half of the class in the computer. So they have to be teaching to them at the same time. So it's been a little bit more difficult than here in California. And just to tell us about what they've done, what's worked for them, what hasn't worked for them. And we know that a lot of them are going back to school, but mostly the elementaries are the ones that are going back to school. So we still have, these are teachers for middle school and high school. So if you guys are interested in letting your teachers know, it's like a support group that we want to start with teachers. But just
really quick, Josie, I just want to acknowledge Sandra. I will reply to your question. I just want Josie to finish up her idea, and I will go back to that.
Okay. Thank you very much. And I'll send it back to you. I just wanted everybody to know what's going on, what we have next week. And once more, I apologize for Dr. Shapiro. I know this is the second time he's tried, and he's trying his best. He said he would try to send some other doctor that is less busy, but in the future. But if you have any questions for him, please send them to me, email them, or text them to me, and I will give them to him and answer you back. My apologies and his apologies for not being able to attend again. Myra, go ahead and do you have any more questions?
No, just really quick. This is for Sandra, and let me tell you that after 2 weeks, that wouldn't. Nobody would say that that is related to the vaccine. Actually, it could have been like a sequela that he had from COVID-19, and it is not related, I would say, to the vaccine. For you feeling uncomfortable, you can research as much as you can just to know what it is, how it works, and the fear or the uncertainty that you right now are feeling is the same thing that we did when we had the influenza at the beginning. At the beginning, nobody wanted to use the influenza vaccine. Why? Because we were not familiar. Let me tell you, now there is a lot more of research, a lot more of advances in technology that led us to speed up some things in relation to approved vaccines. As I said, it depends on you. If you are allergic or if you had an allergic reaction previously, because the issues that are related to the vaccine are more towards allergic reactions than to other consequences. And as I said, this is not for you to not get sick. It's for you to not to end up in the hospital or dying. That's what they're trying to protect you. I see that someone else has a hand raised, or am I wrong?
And please, everybody, if you have not got the COVID, please stay covered, put your mask on, wash your hands, please protect yourself, protect your family. I know it's hard and you say it's not gonna happen to me. It's very, very terrible feeling. Everybody feels differently, but it's very, very terrible. So please protect yourself, keep your hands clean, wash your hands, put your mask on when you're out in the streets, out with the people. Do anything you can to prevent from getting the COVID-19. Myra, do you have anything?
Just keep all the measures. And even if you get the vaccine, you need at least 1 week for your body to start developing the cells that will protect you. 1 week. Then for the second week, those cells will be more stable. The second dose is because you need memory cells to create those. The recent third vaccine that is available that you need just only one, that is a good choice as well. What you need is just to create those memory cells in your body that allows you to attack the virus. So you want to get protected if you can, if you are able, if you're not allergic, if you don't have any health condition that would prevent you to get the vaccine, I would suggest to get vaccinated. And please keep your distance. Take care of yourself. By taking care of yourself, you are taking care of others. You are taking care of your loved ones. So just keep that in mind. And we got this. We are all in this, and we're going to survive this. So thank you.
Thank you, Myra. Thank you for coming in and giving us that information that you're sharing with us. I want to say thank you again. I guess we're going to end up a little earlier, but I appreciate everybody coming, and I apologize once more time. Dr. Shapiro keeps calling, his assistant keeps texting me and saying he's very, very sorry that he wasn't able to get here. I apologize, and I would hope that you guys come and join us next week and if you know any teachers, please share the website with us, the link, so we could have them. We need support for the teachers. The teachers are having a hard time teaching in a computer and a black screen, especially middle school and high school teachers. Please join us and give them their support. Tell them what you guys think. Listen to what their issues are, what their problems are, how they're feeling, how they're coping with all this. And they want to do better for your their students, for your kids, for our kids. And I hope to see you guys next week, the 11th. And we are going to change it, the time. We're going to have it at 3 o'clock because all the teachers are in class at noon. So the webinar next week is going to be at 3 o'clock from 3 to 4. So all our teachers can join us. So we are having the teacher from Texas, Chino, California, Arizona, one from City of Riverside, one from Jurupa Valley, and one from Colorado. So thank you very much for everything. And Myra, do you want to say something else? I just want to say thank you for everybody to
No,
understand.
just thank you. Thank you for your understanding, for your patience, for being here with us. And if you have further questions, please email Josie and she will get those to Dr. Shapiro. Thank you.
Thank you very much. And I hope you guys have a great rest of the week. And we'll see you guys next week at 3 o'clock. Thank you. Have a great evening.
Bye-bye.
Bye-bye.